You're considering eyelid surgery, right?
Yes.
Okay. What reasons are you considering it for?
I've been considering it for a while for two reasons. Underneath, I have the dark circles under my eyes, and I just look tired all the time, and I have a lot of friends telling me I'm always looking tired. And the upper lids kind of overhang to the point where they get my eyelashes.
Okay.
So.
Alrighty. And how old are you?
35.
Okay. Do you get to sleep at night, or?
Yes, I sleep pretty well.
Okay. Do you eat a lot of salt?
Moderately.
Okay. Sometimes when you eat salt, it can increase the puffiness in the eyes. That's one of the things that might decrease some of the puffiness.
Okay.
Has it been like this all your life, or is it getting worse?
It's been bad all my life, but it's getting significantly worse the last 5 years or so.
Okay. And do you have any problems with vision in your eyes?
I wear contact lenses, but I haven't had any other problems.
How about dry eyes?
No.
None. Okay. Well, let me point out the things that probably you're seeing.
Okay.
Everybody has a little fat underneath their eyes. There's a compartment near the nose, in the middle, and on the outside. And if you just gently push your eye, you can see some of that fat kind of bulging out. And you mainly have some extra fat here in the inner portion and the middle portion. There's not as much out here. That's causing you to look a little tired. And these circles that are underneath your eyes are there for several reasons. Number one, the skin is a little bit thinner there anyway, and you can see the veins, and I can't do anything about that. That's part of your skin. But one of the reasons why it looks a little bit dark is because there's a shadow. You've got like a hill, a valley, and a hill. Because this bump, it kind of accentuates that shadow. And by taking out some of this fat, it will smooth this out, and it will make that look a little bit less noticeable. The other part is, as we get older, the tissue from the cheek starts coming down this way and separating from the rim here. And so that's another reason why sometimes there's a little bit of a crease right there. But I think that if you took out some of this fat and smoothed this out, it would look better.
Okay.
You also have a little bit of extra skin, not much, but just a little bit, and little tiny wrinkles. What the lower lid surgery is going to do for you is it's going to help smooth out this fat, and we'll take out just a little bit of extra skin to tighten this up.
So it will help with the wrinkles?
It will help, but it's not going to get rid of all of them, because that's from permanent, smiling and closing your eyes is permanent damage caused by that. And we don't want to pull too hard, because if we pull too hard trying to tighten that up, there's really nowhere for this to be pulled to. I mean, you can tighten it up in the corner here, but if you try to tighten it to the lid, there's just so much tension that lid will come down, and you don't want to end up with a problem like that. Most of the problems associated with eyelid surgery are because too much skin is taken out, I think, and if you take out too much skin in the lower lids, it can change the shape of your eye, and this lid can come down. Look straight ahead, straight ahead. If you take out too much skin from the lower lid, the lid can come down, which is called scleral show, where you see the white portion underneath the eye. It can get to the point where it's so unstable that the lid can actually fold down, that's called an ectropion. It can come down like that. So that's from taking out too much skin. On the upper lid, sometimes you take out too much skin, you can't close your eyes, so we don't want to do that either. Now, there's several ways you can do this surgery. One way is to make an incision on the outside, which is underneath the eyelid. The other way to do it is to make the incision inside the eye. Now, here's the advantages. If you make the incision outside the eye, you can take out a little skin, you can take out the fat, and you can tighten the septum or the compartment where the fat is. If you go inside the eye, you cannot tighten the septum, and you can't take out extra skin, but you can take out the fat. So it's useful for people who don't have a lot of extra skin, and you might be a candidate for that. What some people will do is they'll take out the fat from the inner incision, and then they'll laser the outside to help tighten up this skin. So that's one of the advantages of doing it that way. Now, getting back to the fat pockets, this bulge is there for a couple reasons. Number one is you've got a little bit too much fat. Number two, the compartment that's holding it in is kind of sagging a little bit, needs to be tightened. So I think it would be best to make an incision for you on the outside right here. And then we'll tighten this up just a little bit. Now the upper lids, there's three things that make an eye look really pretty. One is to have a nice pretty shaped eye and a nice color, which you have. The other is to have a nice arch, which you kind of have that too. But the problem that you're having is you have just a little bit too much puffiness here, and you aren't able to see your upper lid. And what I'd like to do is take out just a little bit of extra skin and a little bit of extra fat, and again be very conservative because I don't want you to be too open-eyed, and I think that will help decrease the volume and the fullness on your upper lid.
Okay.
So you're raising your lids up a little bit, you're raising your brow up, but when it's down, you get a picture of that right there. Just lifting this up right here. Okay?
Here are the preoperative photos of the patient. You can see what concerns her. She looks tired since there is extra bulging fat in the upper and lower lids. Because of the excess skin in the upper lids, there is poor visibility of the upper lid fold, and the eye looks small. This is a photograph taken of the patient 6 days after the surgery. This reflects the amount of swelling and bruising which might be seen when having an upper and lower blepharoplasty. It is important to note, however, that she also had surgery on her nose, and it was broken. If that were not the case, she would have less bruising and swelling than you see here. Without the splint, she could probably feel comfortable in public at this stage with some makeup or concealing sunglasses. These are photos taken 2 weeks after her upper and lower eyelid surgery. She is opening her eyes wide so you can try to visualize the incisions on the upper and lower eyes at this stage. Although slightly red, they are not noticeable even at this stage and will continue to improve.
I wanted to ask you a little bit about your procedure. It was 6 weeks ago for your upper and lower eyelid surgery, and how painful was it?
It really wasn't painful at all. I was surprised that it wasn't as painful as I thought it was going to be.
Did you take pain medications,
I
put
did
ice
take
on your eyes?
Vicodin. Yeah, I did put the piece on my eyes for a couple days to make sure. I did that quite a bit. And I had the Vicodin, so I did take that for 3 days solid, and then I'd take half one occasionally.
Okay. Was there anything unexpected or a surprise after your surgery on your eyes that you weren't anticipating?
No, I thought it was going to be much worse than it was.
Okay. All right. Do you have any tips or advice for others that are contemplating or thinking about this surgery that might make it helpful for them during recovery period?
Well, I kept the peas on quite a bit. I did that all through the night and continuously for the next 2 or 3 days.
The frozen bag of peas?
The frozen bag of peas, right.
Okay.
I do think that helped quite a bit.
Okay. Let me ask you a few questions that are just samplings of when you felt like you could do something. How long would you say it would be after your surgery on your eyes that you could kind of walk around the house and, get around inside?
I think I stayed in bed for the first 2 days, and the third day, by the end of the day, I was up walking around doing stuff.
Okay. And how long would it take you before you think you could walk around a mall?
Oh, within a week.
And how about getting back to a desk job?
I went back to work 6 days after the surgery.
Okay. Are you back exercising yet?
Yeah, I started doing that by week 3. I was back at the gym.
Okay. And one of the common questions patients want to know is if you're out in public,
right.
How long, before you feel comfortable in public, and did you use makeup, did you wear glasses, or how did you?
A week after my surgery, I went out because it was a friend of mine's birthday, and I just wore some extra makeup, and no one noticed anything.
Okay.
So my best friend said, "Why are you wearing so much makeup?"
Are you happy that you had the procedure done now, looking back at everything?
I'm thrilled. Really glad I did it.
So you do it over again?
Yes, in a heartbeat.
And what about your eye surgery made you the happiest?
Well, I was really happy that it opened up my eyes, but I'm most happy because now I don't look so tired.
Okay. Great.
These are the before and after photos 6 weeks following her surgery. She is also wearing her makeup. You can see a nice improvement in the appearance of the eyes. Excess skin has been removed, allowing more visibility of the upper lid. The eyes appear more open without changing their shape or tilt. Excess bulging fat has been removed.